Ambulance provision is likely to be the area most affected by the strike. The London service, for example, was working normally today, but warned of significant pressure tomorrow, with union members responding only to emergencies. Military drivers will be among those drafted in to try to keep services running.
The contingency plans include support from staff across the NHS. They include private ambulances, they include the police, and they include the military.
Unions claimed they hadn't been consulted and were concerned that non-NHS drivers were being used to cover the strike. With the action across the health service due to start at 7 o'clock tomorrow morning, management urged staff to think hard about the consequences of what they were doing.
The safety of our patients has to be our priority. That's why we work for the NHS, that's what we do. So I know that anybody thinking of taking strike action tomorrow will be thinking very carefully about that and putting the safety of our patients first.
7 unions are taking part in the strike, including the Royal College of Midwives, who will walk out for the first time in their history. The unions taking part have more than 400,000 members in the NHS in England, out of a total of 1.3 million staff. It's a 4-hour strike, and it'll be followed by 4 days of working to rule from Tuesday. The dispute flared up after the government decided not to go along with the recommendation of a pay review body that all NHS staff should get a 1% increase. Ministers said they should either get 1% or an annual salary increment based on seniority, but not both. That angered unions. The government said in the current financial climate, there was no alternative. Midwives will continue to provide maternity care, though some antenatal appointments will be postponed. Their union says the decision to strike shows how unhappy they are over pay.
It's a demonstration of the strength of feeling of midwives that they've been badly treated by the government, unfairly treated. They just want fair pay. 1% would have been enough to satisfy midwives.
So how sympathetic is the public to industrial action in the NHS?
Well, they have a right to strike the same as anybody else has, you know, if conditions are not right.
I don't think they should, really, no.
They're doing a very good job, but I think it's a very hard job.
While NHS managers say robust contingency plans are in place, they add that patients will need to bear with us. Hugh Pym, BBC News.